On behalf of Anil Foundation ACHE, I welcome you all on the CME on Achieving SDG 3, de-addiction of drugs, tobacco, alcohol and smartphones. I would like to thank Indian Association of Preventive and Social Health and Maulana Azad Medical College and Special Dr. Professor Nandini Sharma. The CME could not have been possible without her support. I'll bring it to your notice that to combat this looming crisis of addiction, ACHE has launched the Nasha Mukti Indradhanush Abhiyan India 2023, a signature campaign for de-addiction and SDG 3, inviting doctors, experts, and citizens to unite for public health. The movement is launched in collaboration with Indian Medical Academy of Preventive Health, aligning with the principle of Sustainable Development Goals 3 to pave the way for addiction-free India. Now, I'll formally start the CMB by inviting Dr. Anil sir to present his views on today's topic, that is achieving SDG 3, the addiction of drugs, tobacco, alcohol and smartphones.
Nearly 60 years after I entered the Maulana Medical College in 1963, and 2 days back on 20th December, we had the Diamond Jubilee of this institution. I am really reminded of those old days, and it's a great privilege to be there where you have been taught the art and science of medicine. And whatever I have gained in the last 60 years today, it is because of my training in Maulana Medical College, and we have Dr. M.M. Singh. And when I came here, I had the bust of Colonel B.L. Taneja. They have a galaxy of top physicians and surgeons who were our teachers. At that time, even honoraries were the teachers. Great Dr. M.M. Singh, Dr. M.L. Sharma, Dr. S.K. Sen. They were P.C. Thara. They were institution in themselves, and they started the Maulana Medical College. When they met in 1954, Pandit Jawaharlal Nehru to start medical college in Delhi. With this, I come to the topic today, and that is the Achieving Sustainable Goal 3. And before that, I must say, Sarve bhavantu sukhina, sarve santu nirame, sarve bhadrana pashyantu, ma kaschid dukh bhag bhavet. May all be happy, may all be healthy, may nobody suffer in any way, may people have well-being of all in mind. With this idea, we started this program, the Government of India, the Department of Heal Foundation, we started this program of educating people, de-addiction of alcohol, drugs, smartphones, drug abuse. So, let's see. So, CME is achieving Sustainable Goal 3, need to focus on international strategies of de-addiction of drugs, tobacco, alcohol and smartphones. See, the key challenges in the achievement of SDG 3 is the growing problem of addiction. And what is addiction? Addiction is a chronic, relapsing brain disease characterized by compulsive substance use or behavior despite harming consequences. Addiction has profound impact on both individual and society. It manifests in various forms encompassing substance abuse such as drugs and alcohol, as well as behavioral addictions like smartphone addiction. According to the WHO in 2019, around 216 people use drugs, and that is 56% of the global population. Around 1.3 billion people smoke tobacco. Around 2 billion people consume alcohol, and around 3.6 billion people, around 46% of the population is addicted to smartphone. This is a huge problem of addiction to the. So, what is addiction? As I said, addiction can cause various health problems for the person who uses drugs such as lung or heart disease, stroke, cancer, HIV, hepatitis, mental disorders, and overdose. It also have other harms such as family members, friends, co-workers, society at large through increased risk of infectious disease, crime, violence, incarnation, unemployment, and reduced productivity. So, what is the most preventable lifestyle behavior is smoking. You can prevent smoking, but unfortunately, even today, it is a major risk for various disorders: lung cancer, chronic obstructive pulmonary disease, cardiovascular disease, stroke, diabetes, cancer. Smoking can increase the risk of infections such as tuberculosis, pneumonia, COVID-19, as well as oral disease such as periodontitis and tooth loss. During COVID, the people who indulge in smoking and alcohol had the highest mortality rate even among the doctors. So smoking and alcohol are the most important preventable risk factor for not only heart disease but other infections, opportunistic infections like COVID. So please remember the importance, seriousness, and the consequences of smoking and alcohol. Smoking harms many organs of the body, causes inflammation, stress, damage, and I think it is very important. Diabetic this thing. So it can cause head and neck, chronic disease, stroke, blindness, gum infections, lung cancer, leukemia, stomach ulcers, kidney disease, pancreas, colon, pneumonia, hardening of the arteries, chronic lung disease, reduced infertility, hip fracture, bladder and cervical cancer. Not only that, it appears, the people who smoke the complexion becomes darkened, they have very bad odor, even when they talk halitosis. They close a person who smokes. If you go to the house, the moment they take out the hanger, you can see that even the clothes have a typical smoke odor. So even the face wrinkles. Smokers in comparison to non-smokers, they age because the collagen fibers decrease in aging and the aging process accelerates. So after smoking, the second is alcohol. First, man takes the drink, then drinks take the drink, then drinks take the man. Please remember that. All these things are our lifestyle influence on our health. You have to be the master of your habits, not your habits master become your master. अपनी आदतों के गुलाम और दास मत बनिए. अपनी इच्छा शक्ति को इतनी प्रबल करिए कि आप उनके ऊपर, वो आपके ऊपर हावी ना हों, आप उनके ऊपर नियंत्रण कर सकें, कंट्रोल कर सकें. खुदी को कर बुलंद इतना खुदा बनाने से पहले बंदे से पूछे कि बता तेरी रजा क्या है. One of the most important organ to be affected by liver cirrhosis. And in India, every year how many people die of liver cirrhosis. It is a precarious. So, brain, memory loss, mood swing, dementia, heart rate, irregular heart rate, pancreas, pancreatitis, stomach ulcer. So, we come to next, smartphone addiction. It is said that and I'm sure most of you are addicted to smartphones till around 12 o'clock, 2 o'clock in the night you keep on. Please do remember, it is one of the biggest problem in the world today, and especially youngsters and people of your age. And smartphone addiction is a behavioral addiction that involves excessive or compulsive use of smartphones, often for social networking, gaming or video watching. The smartphone addiction can cause physical problems such as eye strain, neck pain, headache, sleep depression, reduced physical fitness, unhealthy eating habits, and they cause in our country more than even 2 days back there was a statistics in Times of India, more than 4 lakh people have injuries, road accidents, because even while I was coming here, you find young people crossing on the green signal, no traffic rules, nothing. Unfortunately, in our country, why road accidents happen? The most vulnerable people are the most offenders. Rickshaw wala, cycle wala, pedal chalne wala. These are the people who are most vulnerable for accident, and they come from the wrong side. Half of the people, the young people, using motorcycle and कान पे स्मार्टफोन लगा हुआ है. लड़कियां क्रॉस कर रही हैं ग्रीन लाइन पर and they are using the phone. This is the biggest problem. Road accidents You are a young student. Your concentration is completely gone. People start calculating 12 into 2, cut smartphone से. But when you ask them 20 into 20, they forget. हमारे जमाने में तो पहले पहाड़ा पढ़ाया जाता, 2 दूनी 4, 2 तिया 6. आज सब वो लोग भूल गए. Why you are, अपने दास क्यों हो रहे हैं इन सुख सुविधाओं के? यही हमारे स्वास्थ्य के, ह्वास की, हमारी बीमारियों की जड़ और उसकी कहानी यही से शुरू होती है. इसलिए स्मार्टफोन कैन ऑल्सो कॉज हार्मफुल इफेक्ट्स. देखिए बच्चों में आजकल बिगेस्ट प्रॉब्लम इन द लेडीज, चाइल्ड बियरिंग एज ग्रुप, इन्फेंट्स. बच्चा दूध नहीं पी रहा, माँ ने बोतल दे दी और गाना लगा दिया स्मार्टफोन का. This is the biggest problem. Young kids using. My own grandson, at the age of 5, I told him not to use, but unfortunately you don't have today control over your grandchildren. What to talk of children? They ask so many questions today, which even I could not ask, or not my son could ask me. They are all wearing glasses. This is the problem. Sleep disorder, lack of clarity, and blue light it affects your brain various ways. So your concentration is completely gone. You can't think your originality, this is completely gone. Sleep disorder. Those young people who have the smartphone addiction, they cannot sleep properly. And today, one of the important factors to remain healthy is 6 to 7 hours sleep per day. So those people, they have insomnia, lack of, and stress. Now, if you have stress because of this, you cannot do your work properly. So please remember, these are the various side effects: fatigue, headache. To overcome all this, as been described before, we have to prevent. There's nothing, prevention is, please remember, better than cure. A good doctor treats the disease, and a better and a superior doctor prevents the disease. It's a Chinese proverb. And unfortunately today in India, you see, most of the diseases, what we call there's lifestyle disease. Lifestyle disease because of our habits. Alcohol, lack of physical activity, smoking, tobacco, smartphone, they cause these lifestyle diseases. And two most important things are your diet. Unhealthy food and lack of physical activity cause all your illnesses, and our job is to prevent not only the addiction but all these things, and they are linked together. Physical activity, lack of physical activity, improper food, drug abuse, they all linked together. So Nasha Mukti, Asian Coalition for Health Empowerment, has launched the Nasha Mukti Dhanush Abhiyan in 2000, aligning with the principle of sustainable development growth adopted by the United Nations 2015 to pave the way for an addictive-free India. Nasha Mukti Abhiyan is a flagship program to reduce the demand for drug abuse in the community, and directly contributes to achievement of 3 areas such as reducing premature mortality from non-communicable diseases, as I said, and strengthening the prevention and treatment of substance abuse, achieving universal health coverage. Is only a national initiative but also a part of the global effort to address the issue of substance abuse and its impact on health and development. Is also aligns with the UN General Assembly special session on the world drug problem, which adopted an outcome document and reaffirmed the commitment of member states to effectively address and counter the world drug problem. It recognized the interlinkage between health and other development goals such as no poverty, quality education, gender equality, reduce inequalities, peace, justice, and strong institutions. So, if you start, as I said, stop, suggestion, रोकना, बचाना, और बचाने के लिए जरूरी है उसको त्यागना, छोड़ना. Suggestion means छोड़ दीजिए, हमेशा के लिए मुक्ति पा लीजिए. So, suggestion, how does it help? Achieving and maintaining results in significant improvement of the physical and mental health. reduce risk of death. Abstinence help decrease the elevated risk of premature death associated with substance use. Substance use. 10% of the people, 10,000 people in India die every year because of the suicide attributed to substance use. Young people, productive life, how much money and they have lost. Enhanced long-term abstinence, better quality of life, fostering improved relationship with personal and professional success, and financial stability. Abstinence reduces the financial burden of substance use, relapse, common risk in addiction recovery, strong support systems. So, and reserve are crucial for the managing community. And if you want to quit something, whether it's smoking, alcohol, or please tell one of your family members, your friend, I want to quit. I have decided to do that. For this, you need to have a strong willpower. आपकी इच्छा शक्ति बड़ी प्रबल होनी चाहिए. जैसा मैंने पहले भी कहा था. So, when you deviate from your path, your friend or your family member will tell you, देखो, तुमने कल कहा था, अब मत पियो इसको. So you have to, reassess yourself. Socioeconomic factors significantly influence addiction vulnerability. Now, it happens generally, whether you take alcohol or smoking, it is in a company. It is an environment which facilitates the supply of these things. So if you want to quit, if you advise somebody to quit, they should not go to that environment, that social circle, that friend circle where they imbibe all these habits. First, stop that. पहले आपको वहां जाना बंद करना चाहिए जहां से ये चीजें आपको मिलती हैं. Bearing today, lower circumstances can lead to barriers in accessing addiction treatment. Barriers include lack of insurance coverage, transportation, and segment. ये सब क्यों हो रहा है आज? इसलिए हो रहा है हम अशिक्षित हैं और अज्ञान हैं. इस अशिक्षित और अज्ञानता के लिए ही इस तरह के कार्यक्रम किए जा रहे हैं कि हम आप जैसे लोगों को शिक्षित करें, तो आप आगे बढ़कर समाज के हर वर्ग को शिक्षित करें. लोगों में जागरूकता फैल रही है. लोगों को जागरूक करिए, लोगों को जागृत करिए कि आप सिगरेट पीने से इतना नुकसान है. आप घर में सिगरेट पीते हैं, बच्चे को इनडायरेक्ट इफेक्ट हो सकता है, कितना नुकसान होता है, वो भी इनहेल करता है, सांस की प्रॉब्लम हो सकती है, बच्चों में प्रेशर हो सकती है, बच्चों में सिगरेट पीने की आदत पड़ सकती है. ये स्ट्रेटेजीज के लिए क्या है? अफोर्डेबल हाउसिंग, जॉब ट्रेनिंग, एजुकेशन कैन ओवरकम बैरियर्स टू एडिक्शन ट्रीटमेंट. वो यही मैंने कहा ना, ज्ञान का दान. हम डॉक्टर सिंह और आपका इंडियन एसोसिएशन ऑफ प्रिवेंटिव मेडिसिन ये ज्ञान का दान ही कर रहे हैं. ये ज्ञान को बांट रहे हैं लोगों में, लोगों को जागरूक करने के लिए आपको प्रेरित कर रहे हैं कि आप आगे चल के लोगों को बताइए. एक से एक दीप जलेगा तभी लोगों में ज्ञान का सागर बनेगा. जब ज्ञान लोगों को यह पता होगा कि सिगरेट से इतना नुकसान है, शराब से इतना नुकसान है, वो छोड़ देंगे. रिड्यूसिंग स्टिग्मा, एड्रेसिंग एडिक्शन स्टिग्मा प्रोमोट्स ट्रीटमेंट सीकिंग बिहेवियर, टेलरिंग इंटरवेंशंस, कस्टमाइज्ड अप्रोचेस फॉर लोअर सोशल बैकग्राउंड्स, इंप्रूव ट्रीटमेंट. हमको लोगों के पास जाके जैसी उनकी आदतें हैं, जैसे उनका व्यवहार है, जैसे उनका वातावरण है, जैसे उनकी शिक्षा है, उसी के अनुसार उनको वो उपाय और साधन समझाने हैं जिससे वो अपना बचाव कर सके. ये सबसे जरूरी है. हाई एंड सोसाइटी के लिए कुछ और जो नीचे तबके के लोग हैं, निम्न श्रेणी के लोग हैं, उनकी शिक्षा के अनुसार हमको वो उपाय और वो साधन सुलभ कराने हैं ताकि वो ये काम न करें. एंड involving families, schools and communities address social and cultural factors in addiction. देखिए इसमें कम्युनिटी का बहुत बड़ा रोल है. If you see somebody is smoking, if 2 or 3 elders in the society or 1 or 2 even neighbors say, देखो ये गलत काम करो, फेंको सिगरेट, आज कोई किसी को बोल नहीं सकता, कोई बताता नहीं है. I think we have to involve the community. No smoking zone. ज्यादातर लोगों जगह नो स्मोकिंग जोन है, लेकिन हमको जो भी अगर आप किसी को सिगरेट पीते देखें उसको टोकिए जरूर, उसको रोकिए जरूर. एक बुरा मानेगा, 2 बुरा मानेगा. अगर आपने 100 लोगों को आए, 10 की तो समझ में आएगा कम से कम. लेकिन हम अपना काम उनको समझाने से, उनको बताने से क्यों चूके. सोशियो इकोनॉमिक फैक्टर प्रोफाउंडली इंपैक्ट एडिक्शन टू वल्नरेबिलिटी. इंक्रीजिंग एक्सेस टू रिसोर्सेज, वो मैंने पहले ही बता दिया. कम्युनिटी एंगेजमेंट इज ए क्रूशियल तो कम्युनिटी प्रोग्राम हम लोग करते हैं, कम्युनिटी में जाके बात करते हैं, झुग्गी झोंपड़ी में बात करते हैं। मैं और डॉक्टर मैं गोयल हॉस्पिटल की तरफ से हम सारे स्कूलों में बच्चों को ये बात बताते हैं। हर संडे को कम्युनिटी आउटरीच प्रोग्राम में झुग्गी झोंपड़ी बस्तियों में जाके उनको एग्जामिन करते हैं। अरे कितनी सिगरेट पीते हो, तुम्हारा फेफड़ा खराब है, तुम्हारे ब्लड प्रेशर बढ़ा हुआ है, तुम्हारे मुंह दांत पीले हुए हैं, अरे तुमको कैंसर हो जाएगा। देखिए, भयभीत हो तन प्रीत गुसाई। जब तक आदमी को मौत का डर, आप उसको डर नहीं बताओगे, तब तक वो नहीं समझेगा। बच्चे से कहो आग में मत जाओ, आग में जाओ, लेकिन जब तक उसका हाथ नहीं झुलसता ना, तब तक उसे नहीं पता आग क्या चीज होती है। इसी तरह आपको लोगों को बताना है, और यही काम हम और डॉक्टर कुमार करीब 30, 35, 40 साल से कर रहे हैं, और हम आपको प्रेरित कर रहे हैं कि आपको भी जाके ये बताना चाहिए। नेक्स्ट, पीयर सपोर्ट एंड कम्युनिटी एंगेजमेंट। ये मैंने बता दिया कि जब तक समाज को कहेंगे, परिवार के लोगों को बताएंगे, आपके मित्रों को बताएंगे, आपका सही अगर वो आपका सहयोगी है, सही आपका शुभचिंतक है, वो आपको सही रास्ते पे ले जाने के लिए सब कुछ करेगा। तो आप अपने मित्रों को, रिश्तेदारों को ऐसे चुनिए जो आपको सही मार्ग पर ले जाने की प्रेरणा दें। अनफॉर्चुनेटली बहुत से ऐसे हैं रिश्तेदार जो खुद सिगरेट पीते हैं, शराब पीते हैं और बच्चों को भी प्रेरित करते हैं। आप उनसे अलग रहिए। सो अल्टीमेटली इफ यू फेल, डू नॉट, व्हाट इज मोस्ट इंपॉर्टेंट? प्रेयर। प्रेयर एंड होप इज द मोस्ट। और आप देखिए हमारे जितने भी बड़े बड़े मंत्र हैं, सबसे ज्यादा कॉमन बनने वाला मंत्र है, पढ़ने वाला है हनुमान चालीसा। बुद्धिहीन तन जान के सुमरो को पवन कुमार, और क्या? बल बुद्धि विद्या देव हुए, हरहो कलेश विकार। क्या प्रार्थना है? बल बुद्धि विद्या देव हुए, मुझे बल दो, विद्या दो, बुद्धि दो, और मेरे विकारों को दूर कर दो। क्योंकि जब आदमी में विवेक होगा, बल होगी, विद्या होगी, विवेक होगा, भले और बुरे का पहचान, तभी उस ना से रोग हरे सब पीरा, सुमरे हनुमत बलबीरा। संकट कटाए मिटाए सब पीरा, जपत निरंतर हनुमत बलबीरा। इसी तरह हम जब पुराने जमाने में, हम जब बड़े होते थे, यज्ञोपवीत होता था, गायत्री मंत्र का पाठ हमारे यहाँ कराया जाता था। मैं गायत्री में भी लेक्चर देने जाता हूँ। ओम भूर्वस्सुः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। तुमने हमें उत्पन्न किया, पालन कर रहा है तू, तुझसे ही पाते प्राण हम, दुखियों के कष्ट हरता तू, तेरा ही इंतजाम मांगते दान हम, बुद्धि हे ईश्वर हमारी बुद्धि को श्रेष्ठ बात पर चला। और स्मोकिंग के ऊपर मैंने एक कविता बनाई थी कि हे दयामय हमारे यही प्रार्थना, स्वच्छों फेफड़े अब बस यही कामना, शक्ति दो छोड़ें धूम्रपान की लत सभी, गाय गुणगान हो न घुटन अब कभी, सबकी सांसें सदा स्वच्छ और साफ हो, ना निकोटीन का विष हो न संताप हो, लत का आदि हूं मैं किंतु यह ज्ञान है, गर न छोड़ा तमाकू तो शमशान है, हे पिता हे प्रभु मार्गदर्शन करो, बीड़ी सिगरेट से दूर जीवन करो। And अरे भैया, and it is not about ideas, it about making ideas happen. This is what the CME is today for. We have given you the ideas, but it is you who have to make it happen. विश्वास रखें, समय कितना भी कठिन क्यों ना हो, ये आपको तब तक नहीं हरा सकता जब तक आप खुद हार न मान लें। इसलिए धैर्य रखें, अपना कर्म करें और विश्वास को कभी डगमगाने न दें। That is what is important. Sometimes life will kick you around, but sooner or later you realize you are not just a survivor, you are a warrior, and you are strong. You are stronger than anything life throws on your way. Hope is such an energy by which any dark part of the life can be illuminated. Let's carry hope. हमें आशावान रखना चाहिए, अपने सोच को मोश नहीं आना चाहिए. And that's what I said. Prayer and hope is the vaccine you need today to prevent all these addictions. I am telling you कि दिन के उजारे में न करो कोई काम ऐसा, नींद न आ पाए रात के अंधेरे में. दिन के उजारे में न करो कोई काम ऐसा, नींद न आ पाए रात के अंधेरे में, और रात के अंधेरे में न हो कुछ ऐसा, मुंह जो छिपाते फिरो दिन के उजारे में. Friends, and I think probably these are my last slide, and you are all doctors. I think and as a doctor, as I said, when you your character is okay, when you are empathic, sympathetic. Medical profession is not a profession, it's an obsession. It is not an occupation. It is life full of commitment. Please remember that.
Thank you very much.